And let me just quickly interject now. It's been advised now that that device, at least for the young children, people less than 12, must be delivered through a bubble called a spacer.
Okay.
So,
not directly.
Not
into
directly.
the mouth.
For the older children, like above 8, they could use the disc inhaler or the meter dose directly. So what I'm saying is that for those mild ones, it's just intermittent. And when you say mild, it's maybe once a week, just a bit of a cough, maybe once a month. At night time, you have a cough, because the cough of asthma is always worse at night or early in the morning. Now, you take your reliever when you feel that your chest is tight or you're coughing. Now, for those, the next group is mild persistent.
Okay, I think we'll have to take the mild persistent when we come back.
Okay.
We're about to go on a break.
That's all right.
We're taking a break right now. You can call in with your questions after the break, after this time out. Stay with us.
Every day you invite us to your home. Now we invite you to our homepage. Join Channels TV on social media. Hang out with us on Google Plus/Channels Television. Follow us on Twitter.com/Channels TV_NG. Friend us on Facebook.com/Channels Forum. And don't forget to like our page. That's not all. Subscribe to our YouTube channels. YouTube.com/Channels Web to get constant video updates on news and events in Nigeria and around the world. ChannelsTV.com, the news at your fingertips.
You're welcome back. It's still Health Matters, and we're talking about how you can handle and control and overcome your asthma attack. It's time to call in with your questions and your comments. The number to call is 01-2206-842. Again, 01-2206-842. Now, you were talking about mild persistent.
Yes.
We have to run through this real fast.
So with the mild persistent now, we're now being advised that we have to give inhaled steroids to them. Now, some people argue and say, oh, I don't want to have any steroids. Is it steroids like the sports people? It's a form of steroids that we're giving you, but it's one that is a very minimal amount goes into your bloodstream.
So it doesn't show up as an enhancer during, a sports competition, that kind of thing?
Well, I wouldn't say that, because I don't know. I can't answer that. But all I know is that in terms of your body systems and complications, when you weigh the benefits and the harm, it is better for you to control your not having acute symptoms than to have acute symptoms and now be given the tablet which you inhale, which is prednisolone.
We're having Isaac calling in from Lagos. We'll get back to you. Hello, Isaac. Emmanuel,
good morning.
calling in from Lagos.
Excuse me, ma. You said something about this spacer on the inhaler. So, is there more because the only children are?
Can you go through that once more?
I said, is there more that a child under 8 must use the spacer?
Okay, she's talking about the spacer.
Yes.
Who must use a spacer?
I think it's advised now that young children must use a spacer. They must not use the inhaler directly. So for
young children will be what age to what age?
At least from infancy to 8 years.
Okay, before we continue with, the different categories, I really have to ask you at this point, what if a pregnant woman is also asthmatic? Does it pose challenges for her in her pregnancy and when she's going to have the baby, seeing that sometimes anxiety or stress could bring on an attack?
Yes. I think if a pregnant woman has an asthmatic attack, she must use her medication. Even when she's pregnant, if she's on the preventers, which is the brown inhaler, she needs to use it. Because if you have an asthmatic attack when you're pregnant, it can be very severe.
So we have two more types.
Yes, so we have and we then have the moderate persistent and the severe persistent. And the severe persistent, sometimes they are called brittle asthmas. Okay. And they need to be under continuous care of an expert in asthma.
Oh, hello. Hello?
Hello, good afternoon.
Stanley from Lagos. Please, your question, Stanley.
I want to confirm that is it a sign? Could this be a sign of one who is asthmatic?
Could what
When
be
you
a sign?
notice that from time to time you experience in breathing, could that be a sign that you are asthmatic? I don't know if you get the question.
Yeah, please, could you, when you experience what in breathing?
Difficulty in breathing.
Difficulty in breathing. That could it be a sign that there's asthma?
Yes, it could be. Is it your difficulty? Do you feel it difficult when you're breathing out, or do you pant when you're running up and down, or are you finding it difficult to breathe when you lie down? What type of difficulty in breathing?
I think we've lost Stanley. Okay. But from what you told me earlier,
yes,
you said that the wheezing happens
yes,
when the person is breathing out.
Yes.
Because the air can go in
easier.
Yes. But coming out is a challenge.
Yes. And as
that could be terrible.
If you have an asthmatic attack, when it gets more severe, even now to breathe in
is also a problem.
Is also a problem. So you then have like a silent chest, and that means death is on its way.
Oh my.
Asthma is a killer. And
so what color are the caps of the last two types? Because I take it those are the more serious types.
No, for the more serious types, they give them a special combination. That's a combination of a reliever and a preventer.
Okay.
So, and we have that
Dixon
in the
on the line. This is really coming in fast.
Okay.
Hello, Dixon.
Yeah,
Dixon from
good
Lagos.
Morning, ma.
Please, could you ask us your question?
Okay, fine. I'm actually a fitness instructor. You know, I was asthmatic patient that I've not had the attack now for like 15 years now. You know, that the question is this: is it possible that much of exercise can prevent it?
Did you get that?
Yes, I got it, yes. And this goes to say, from what I was saying, you don't stop exercise. You take your preventers, or you take your preventers regularly, and if you're going for an exercise period, you can take your relievers, or there's some other drugs, they're called mast cell stabilizers that you can take. So they're medications you can take. But what we find is that the fitter you are, a lot of asthmatics, the better they actually become in terms of controlling their symptoms.
Okay.
And I think one of the reasons why is because most of them are slimmer, because obesity is a risk factor, and they also breathe better, because they found that many people who have asthma are not deep breathers. They're very shallow breathers. And you can understand if you have a lung that is red with a lot of sticky mucus, if you don't inhale and exhale properly, this can lead to further problems in your airway. So I'm not surprised that with exercise, he's a healthier person now and is having less. And when you exercise, you're actually a happier person.
Somebody's on the line.
Hello?
Hello, Nike.
Hello, thank you.
You have your question.
I'm calling from PT2. I have a little son. He has noisy breathing since he was like 3 months. And I've been battling with it. I was referred to General Hospital, but they said to know if there's any relationship between sinuses and asthma and what I can do.
What's the relationship between what?
She's talking about a son who's had noisy breathing for 3 months.
Hello?
And
Since 3 months old.
3 months.
Yes.
3 months ago.
Yes. Okay.
And she doesn't know
Are you still there? Did you say since 3 months or 3 months ago?
When he was 3 months old,
Yes.
he was so, but he has noisy breathing. He's still on.
Yes. How old is he now?
He's 7.
He's 7 years and has had noisy
Yes.
breathing. I think you should go to your doctor to do a good evaluation, because you can get noisy breathing for problems with the upper airway or the lower airway. And it's a doctor that is going to be able to tell you the difference. Because things like he just has a narrow airway, and when air passes through, it's noisy.
I understand he was diagnosed for sinuses. So I just want to know if there's any relationship between sinuses and asthma.
Okay, yes. So, they said he has some problems with his sinuses. So that is upper airway. The only relationship is that sometimes when you have sinus problems, there's an underlying allergy problem. And so it may match on to become asthma later on, but sometimes it doesn't. So you take each case as it comes. But it may be a good idea to do an allergy test, because that will tell you if we would now be doing preventative manipulations like I just described earlier.
Now, can this asthma be outgrown?
Yes. Yes.
So somebody can say, I used to have asthma, now I don't have it.
Yes.
It happens to what category of people?
Particularly in the children who, persons who have it when they're young. It is possible that they can outgrow it, particularly if they take their inhaled steroids, if they are mild persistent and they start taking the inhaled steroids early. Because everybody thinks asthma doesn't cause any damage, because they always say it's reversible, it's, recurrent. It has been found now that it causes a little bit of damage, and as it gets older and older, this can build up, which cannot be recovered. So there's now something called airway remodeling, which is associated with asthma. So I think we should all work, anybody who has problems with recurrent cough, tightness, exercise intolerance, you need to see your health practitioner for evaluation of asthma.
Is there any relationship between asthma and pneumonia?
Yes. Well, both of them are dealing with the lungs. Now, most asthmatic attacks are not set off by bacterial infections. Viral infections can set it off, all the triggers we've talked about and all the allergens. But sometimes you do get a secondary infection because your lung is now wet. And if you're not breathing well, that means there's not movement of air. So you could get a secondary infection, which is a pneumonia.
I'm going to have to stop you there. We've run out of time. Thank you so much for coming. That has been very informative. Thank you for being with us. You've been a wonderful audience. I have to thank Emmanuel, Stanley, Nike, and if I've forgotten your name, please forgive me. Thanks for being with us. Have a nice day. I am Mary Alale Yusuf.